This teachable moment is brought to you by the Jewish Healthcare Foundation and the Pittsburgh Regional Health Initiative. With the goal of reducing door-to-room and door-to-physician times and patient elopements, learn how a team from St. Clair Hospital tackled these issues.
We knew that there was a problem, and it was very clear and very easy to identify. Dissatisfied patients, long waiting times, numerous patients leaving without even seeing a physician, and a very frustrated staff. A patient would arrive at the front door of the emergency department. Then they would typically have a seat in the waiting room. They would fill out a piece of paper with their name and some basic identifications and a reason why they were here. Then they would have a seat in the waiting room. They would then call the patient back to a triage room. At that point, they would get a full nursing assessment done. And once that paperwork was completed, they were typically asked to have a seat back in the waiting room. The patient would then be asked to go to the registrar, and their office was down the hall away. They would complete a registration process and be asked to have a seat in the waiting room again. Their paperwork would then go back to the back. It would be put into a queue, and that patient would then be waiting in the waiting room until they were called to the back. And then the charge nurse would take them back and put them in the room. Typically, they waited for the physician to come to the room, make an assessment, and then put orders into the system or let the nurse know that there was work to be done.
It's nice to meet you. Sorry you're not feeling so good.